If you are over 60 and struggling with sciatica or burning nerve pain in your back, hips, or legs, I need you to hear this clearly. Stretching your hamstrings is not fixing the real problem. Pulling on your leg might feel good for a few minutes. Massaging your calf might reduce symptoms temporarily. But if the nerve is being compressed in your spine, you are treating the smoke, not the fire. And that's why so many people over 60 feel stuck. In today's video, I'm going to show you the real reason sciatica happens after 60, why most leg stretches don't work long-term, the only 3 exercises you need to relieve pressure on the nerve, and 3 common mistakes that are silently making your pain worse. And number 2 on the mistake list might surprise you, because almost everyone over 60 has been told to do it. But first, we need to understand something extremely important. The real cause of sciatica after 60 and why most people get it wrong. Most people think sciatica is a leg problem. After all, the pain is in the leg, the burning is in the calf, the tingling is in the foot. So naturally, you assume the issue is down there. But that's not where the problem begins. The sciatic nerve is the longest nerve in your entire body. It starts in your lower back, specifically the lumbar spine, and travels down through your hips, thighs, and into your feet. Now imagine your sciatic nerve like a garden hose. If someone steps on the hose near the faucet, the water flow gets disrupted. You wouldn't go to the end of the hose and start stretching it. You would remove the foot pressing on it. That foot, in people over 60, is usually not a disc herniation. That's the key difference. Between ages 30 and 50, sciatica is often caused by a bulging or herniated disc. But after 60, it's far more likely due to spinal stenosis, narrowing of the spinal canal, degenerative disc changes, facet joint arthritis, thickened ligaments around the spine. These are normal age-related changes. Wrinkles happen to your skin. Degeneration happens to your spine. It doesn't always cause pain. But when the space where the nerve exits becomes smaller, the nerve gets irritated. And irritated nerves do not like compression. That's when you feel burning pain, electric shock sensations, numbness, tingling, weakness, pain that travels below the knee. Now here's something hopeful. For degenerative sciatica, which is most common after 60, bending forward often helps. Why? Because forward bending opens the spaces where the nerves exit. Standing tall with a rigid posture actually closes those spaces. This is why so many older adults say, "I feel better leaning over a shopping cart." That's not random. That's biomechanics. Now let's get into the first exercise that gives immediate relief. Chapter exercise. 1. The 90-90 decompression position. This is the fastest way to reduce pressure on the lumbar spine. Lie down on your back. Place your feet on a chair, couch, or stool so that your hips are bent to about 90 degrees. Your knees are bent to about 90 degrees. Your body should look like the letter Z from the side. Now let your lower back relax. Don't force it flat. Just let gravity do the work. Stay here for 5 to 20 minutes. You may feel relief within 60 seconds. Why this works? When your hips are flexed like this, the joints in the lower back open up, the pressure on the nerve decreases, inflammation reduces, muscles relax, and if you're over 60, there's a bonus, because your feet are elevated above your heart. This also improves circulation, reduces lower leg swelling, decreases heaviness in the calves. You can even gently pump your ankles up and down to enhance blood flow. This is your emergency position. When pain flares up, go here. Morning, afternoon, before bed. Now before we move on, a quick but important safety note. If you ever experience new numbness in the groin, loss of bladder or bowel control, severe weakness in both legs, go to the emergency department immediately. That could be cauda equina syndrome, which is rare but serious. Now let's move to the exercise that actually creates long-term change. Exercise number 2, repeated lumbar flexion, the space creator. If exercise number 1 removes pressure temporarily, This exercise helps create more space in your lower back joint so the nerve stays calmer longer. Remember this principle. For most people over 60 with degenerative sciatica, forward bending opens the spine. Extension, standing tall and arching backward, narrows it. So we use flexion strategically. Here's how to do it safely. Sit toward the edge of a sturdy chair. Feet slightly wider than shoulder width apart. Place your hands on your thighs. Now slowly slide your hands down your legs as you bend forward. Let your head and neck relax. Let your back gently round. Go only as far as comfortable. At the bottom, pause for 5 seconds and take one slow breath in and out. Then slowly come back up. Repeat 10 times. Now here's what you're looking for. Your leg pain should either decrease or move upward toward the hip or lower back. That upward movement is called centralization. And it's a very good sign. If the pain shoots further down your leg, stop the exercise. But if it eases or climbs upward, that means the nerve pressure is decreasing. For people with spinal stenosis, this movement is powerful. In fact, I often recommend doing it. Before walking. During walking, take a break and sit. After walking. Now, if you have more flexibility, you can try 2 additional flexion variations. Option 1. Knees to chest. Lie on your back. Bring both knees toward your chest. Hold for 20 seconds. Repeat 3 times. This creates even more opening in the lumbar spine. Try. Option 2. Child's pose. Start on hands and knees. Slowly sit your hips back toward your heels. Let your head relax. Extend your arms forward. Hold for 20-30 seconds. Repeat 3 times. Now listen carefully. Flexion exercises are not about stretching your hamstrings. They are about opening the spinal canal. That's a completely different goal. Now that we've reduced pressure and created space, we need to stabilize that space, because without stability, the compression comes back. Exercise. Number 3. Core stability for lumbar support. If your spine is unstable, your body compensates, and that compensation irritates nerves. So we strengthen the deep abdominal muscles that support your lower back. Lie on your back, knees bent, feet flat. Place your hands on your thighs. Now gently pull your belly button toward the floor. You should feel your lower back lightly flatten. This is a small movement. Now, as you exhale, lift your shoulder blades slightly off the ground. Not a full sit-up, just a controlled curl. Pause at the top. Lower slowly. Do 2 sets of 15 repetitions. If your neck gets tired, lightly support it with your hands, but do not pull. For an easier version, lift just your head and shoulders 1 inch. You should feel your abdominal muscles engage, not your neck. Why this matters? When your core is stronger, your spine is more stable, the vertebrae move less, the nerve has more protected space. Flare-ups become less frequent. Now you have the 3 exercises that relieve pressure, create space, and build stability. But this is where many people sabotage their progress, because even if you do everything right, certain habits can make sciatica worse. Let's talk about the 3 biggest mistakes I see in people over 60. Mistake. Number 1. Forcing perfect posture. You've been told your whole life, stand up straight. But for degenerative sciatica, forcing your lower back into extension can increase nerve compression. Standing rigid and arching your back narrows the spaces where nerves exit. Instead, allow a relaxed posture. Not slouch dramatically, but not military straight either. When watching TV, a recliner is often better than a rigid dining chair. When walking, lean slightly forward from your hips. That's why shopping carts feel good. They naturally place your spine into mild flexion. Now here's the next mistake, and this one surprises people. Do you ask your mistake? Number 2, overdoing. Walking is not bad, but for spinal stenosis-related sciatica, prolonged walking can irritate the nerve. Why? Because walking is slightly extension-based. The longer you walk upright, the more the lower back narrows. If walking triggers symptoms within 5-10 minutes, that's your sign. Instead, Take seated flexion breaks. Try a stationary bike. Use a recumbent bike. Use a pedal exerciser while seated. Cycling keeps the spine in flexion. Many people who cannot walk long distances can bike comfortably. That's not weakness. That's mechanics. Now the third mistake is about pride. Mistake. Number 3, refusing mobility aids. I understand this one deeply. No one wants to use a cane. No one wants a walker. It feels like giving in. But here's the truth. Using a rollator or leaning forward on support reduces lumbar compression. It can decrease pain, increase walking distance, reduce fall risk, prevent flare-ups. Even using a grocery cart intentionally can help. Mobility aids are tools. They are not surrender. Now let's zoom out for a moment. Sciatica after 60 is rarely about something being torn. It's usually about space. Create space, maintain space, strengthen support. That's the formula. You now understand the 3 exercises. But here's what most people really want to know. How long will it take to feel better? And just as importantly, when should you worry? Let's talk about both. How long does sciatica relief take after 60? If your sciatica is caused by age-related changes like spinal stenosis or degenerative discs, improvement is usually gradual, not instant. Here's a realistic timeline. Week 1. You should notice less intense flare-ups, faster recovery after sitting, slight reduction in leg burning, not perfect relief, just improvement. Week 2, 3. You may notice less leg tingling, pain staying higher up in the hip instead of shooting down the calf, walking tolerance slightly increasing. That pain moving upward is centralization again. That's progress. Week 4 to 6. Most people who are consistent experience fewer flare-ups, reduced need for pain medication, more confidence with movement, less fear of walking. Now here's something important. Relief does not mean zero discomfort. It means the nerve is less irritated and more stable. Sciatic nerves can stay sensitive for months even after pressure is reduced. That doesn't mean damage is worsening. It means healing takes time. When do you actually need imaging? Many people rush to MRI scans, but here's the truth most doctors know. After 60, almost everyone's MRI looks bad. Disc bulges, degeneration, arthritis, stenosis, even people with zero pain. Studies show that up to 80% of adults over 60 have disc bulges on MRI with no symptoms, so imaging does not equal pain. You should consider urgent medical evaluation only if you experience sudden groin numbness, loss of bladder or bowel control, rapidly worsening weakness, severe trauma. Otherwise, conservative management is usually the first-line approach, and most cases improve without surgery. Why injections sometimes fail? Many patients receive epidural steroid injections. Sometimes they work, sometimes they don't. Here's why. Steroids reduce inflammation, but if the real issue is mechanical narrowing from posture, muscle weakness, and instability, the injection may calm the nerve temporarily. But the compression pattern remains. It's like spraying water on a fire while someone is still pouring gasoline nearby. That's why strengthening and spinal positioning matter long-term. Structure the 4 to 6 week reset plan. Here's how I recommend structuring this. Daily. Z position relief, exercise number 1. Seated lumbar flexions, exercise number 2 every other day. Core strengthening, exercise number 3. Before walks. 10 flexion repetitions, during walks. Take seated breaks if symptoms rise. Avoid long upright standing, aggressive hamstring stretching, overextension posture. After 4 weeks, reassess walking tolerance and symptom frequency. Now here's something most people don't talk about. The emotional side of sciatica. Sciatica is not just physical. It changes behavior. People stop moving. They avoid stairs. They cancel outings. They fear traveling. And fear increases muscle tension. Muscle tension increases compression. Compression increases nerve irritation. It becomes a cycle. Breaking that cycle requires controlled exposure to movement, not rest, not avoidance. Strategic movement. That's what you're doing with these exercises. A quick reality check. Sciatica over 60 is rarely fixed in one stretch, but it can be managed, it can be improved, it can become predictable instead of terrifying. And predictability removes fear. When you know, if it flares, I lie in Z position, suddenly you're not helpless anymore, you're in control. Final recap. If you are over 60 with sciatica, it's probably not a leg problem. It's usually a lumbar space problem. Your 3 key actions are: 1. Remove pressure, Z position. 2. Create space, lumbar flexion. 3. Stabilize space, core strengthening. Avoid forced upright posture, excessive walking without breaks, pride-based refusal of mobility support. And most importantly, stay consistent. Relief doesn't come from intensity, it comes from repetition.